Welcome back to the channel, everybody. I hope you're having a fantastic morning. And in today's video, we are doing a reaction and commentary to EMS system in Virginia called Richmond Ambulance Authority. They operate the System Status Management Response Model, and they are located in the city of Richmond here in Virginia. I didn't grow up with them. That's a lie. But I've heard of them in different conferences. I've seen a lot of their content, and they have some of the same issues as AMR does in Knoxville. And so in today's video, we're going to be talking about staffing because this pretty much sums up the entire reason of what's going on, not just in Virginia and Tennessee, but pretty much throughout the entire country. If you don't already know, there's a volunteer shortage, there's a staffing shortage. Healthcare in general has shortages all over the place when it comes to staffing. Um, Not the greatest working conditions, things of that nature. And this video, if I remember right, it's been a while since I've seen it, kind of highlights all of that. Just a quick tidbit before we get into the video. I am starting a EMS company, ambulance company of myself, and that'll be operating inside Knoxville, Knox County. If you haven't seen the opening video, it's called Tennessee Public Safety Group, a company overview, and it's about a half hour long. So scroll back in my channel and find that one, much more detailed than this will ever be. Um, but basically, we're going to jump into it if I can get the computer working. All right, so if you would like to donate to the channel, you'll, the QR code is on your screen. If you'd like to support my work and other works of that nature, you can find us on the different channels listed on your screen. Head over to our website, have a look at the Tennessee Public Safety Group webpage. If you would like more details on the company, how I'm going to set it up, our goals, purposes, motivations, etc. If you can also sign the petition to get AMR out of Knox County and provide a $25 donation. That's a separate webpage off of our website. And if you'd like to um, support me and get this higher in the algorithm, just watch it to completion. Um, like, comment, share, and subscribe. And let's jump right into it.
Shocking story from a pregnant woman who says she waited for an hour after a car accident for an ambulance to arrive. Well, since our first report a month ago, several Richmond Ambulance Authority employees have reached out to our Brendan King with a number of issues. He dives deep into them all in tonight's Problem Solvers investigation.
We're at Bells Road in Richmond. There's no ambulances.
June 12th on Richmond's south side, a pregnant woman injured in a crash waits for an ambulance that arrives 1 hour later.
They're trying to get an ambulance from Chesterfield because no one is available. This is not okay, and there needs to be light to the situation.
All right, so, we're only 38 seconds in, and this is absolutely true. When I worked for AMR, because of the operational model of system status management, sometimes everybody would be at the hospital, and we called that a level 0, meaning that there are 0 available ambulances inside the county to respond to any future incidents. And as she mentioned, Chesterfield responding, that's one county over, if I remember right, um, in Richmond. And yeah, we would have to call AMR from Blount County in Tennessee to come help us out, which was a 45-minute response period, depending on how busy they were. Or sometimes we would have to go to them and help them out because they ran out. And it's not that we don't care to help each other out. It's all, part of the job. It's just something you get accustomed to doing. But when it's 5 times a day that this happens, or 18 times a day that you run out of ambulances, I mean, at what point do you just say this is a giant failure? AMR is a giant failure. It's bottom of the barrel. It is a service highly operated on profit. They could care less about people. And actually, we're not getting into profits today, so let's jump back in the video.
A lady waiting for an hour, that's a shame. I'm not surprised.
After our story aired, more than a dozen former and current employees of the Richmond Ambulance Authority contacted CBS 6, sharing their experiences of low pay, low morale, overworked, and stressful conditions.
Retention at Richmond Ambulance is tough. A lot of people don't like it.
Two former employees who recently left RIA for higher paying healthcare jobs agreed to talk to CBS 6 on the condition we protect their identities.
It's more of like a focus on money versus we need to help the citizens of Richmond. And that's the main thing that led me to leave, is that I felt like I couldn't help the citizens of Richmond.
RIA.
So, I mean, it shouldn't be a surprise to anybody out there. We got into this field to help people. We got into this job industry because it was fun, it was exciting. But when you deal with, 20 calls a day, 30 calls a day in 12 hours, because, there's 6 ambulances within the county, insert county here or insert city here. I mean, you are running your absolute tail off. I've been harassed at hospitals saying, hey, why do you still have a patient? Why aren't you back out on the road? There's cars, what we call calls holding, or you sign in at the beginning of your shift and there's 14 calls that just never got ran from last night. And then you look at the hold time on them and you're looking at 12 hours, 14 hours, 20 something hours. It's just absolutely incredible. I mean, not to mention the low wages. When I got hired with AMR, I had 12 years of medical experience, and their current um, model gave me 10 cents a year of what they call verified experience. So because I was from out of state, somehow that it, negated everything that I had known, all the training I had done, all the certs that I had accumulated, etc. And so I got like a 20-cent raise because that was my time in Tennessee that could be verified. It was absolute crap. And then you go to McDonald's on your, 2-minute lunch break and they're making $3 more than you an hour. Or I went to Wendy's and they were making $6 more an hour to flip burgers than I was making. And it's not about the money, but I got bills to pay. I mean, we want to help people. Again, that's the whole reason we got into this job. But if I can't pay rent, if I can't get a car payment done, then I have to leave emergency services in order to go for a higher paying job. That's why almost all of us have 2 jobs, 3 jobs. Even right now, I'm with a county fire rescue service and a private ambulance company, and I'm looking at getting a third job currently because the economy sucks and life is hard. Um, but it just it's really hard to go to a job every day, do 60 hours or more a week, and then not be able to pay your bills. That it's absolutely stupid.
Founded in 1991, operates in the city like a business. By city ordinance, the agency is solely tasked with responding to both 911 calls and NETS calls, or non-emergency transports, also known as pre-scheduled calls, like driving a patient from their home to dialysis or to another hospital.
It would be often that we would go to North Carolina. It would be often we'd go to different states.
When the agency is fully staffed, the system works. But with low employee numbers right now, sometimes 911 calls that are not considered priority 1 or life-threatening injuries, like in the case with the pregnant woman, tend to wait longer for an ambulance.
Knowing when you're walking into work at 6 a.m. and marking up and you're the second truck only. There's only 2 ambulances in the entire city, and knowing that that other truck was a truck that's staying late from last night.
This employee left the agency earlier this year.
So that's what I alluded to in the other video. Um, AMR had a policy where you can't go home until I think our policy was you had to have 2 ambulances in the county available before they'll let you go home. And so sometimes, you're held over 4, 5, 6 hours. A lot of times you don't know when you're going home. You don't know, if you're going home, for lack of a better phrase. And as, this person said, the system status management model, you live in your truck. When you leave the headquarters building or the garage, or in our case, a warehouse, you had to bring your lunch. you had to bring absolutely everything because if you were scheduled 12 hours and you get held over 4, that sucks. That's a bad day. You need food, you need water. Um, you just we're all human. And the ambulances are usually very small, they're very cheap, they barely work. Um, it was an absolutely horrific experience. And then, yeah, when you come into work every day, you sign in on the computer, and before you do your radio sign in, and you'll see 5 calls holding, 10 calls, 20 calls, etc. And it's absolutely a morale killer. So you get low wages, you get long hours, you never know when you're going home. And you, I don't know how Richmond does it. This video is from a couple years ago. I think they've solved some of their problems. And not to rag on them too much, it's the operational model that's the problem, not necessarily the companies. Where when you're a private company, as most of them are in Tennessee, you're not tax funded, and so you have to do the dialysis runs, the doctor's appointments, the long distance transfers, the psych um, interfacility transfers that typically go out of state or across the state. It's very hard to run a 911 system when most of your trucks are doing that and to generate the money. Or if they didn't do that, you don't have the money and your company goes under. I mean, it's an absolute disaster. Um, it's very hard to deal with.
Not that, the dialysis appointments aren't important, but the fact that this difficulty breathing patient is waiting while I'm going to meet someone at dialysis, it just didn't set right with me.
It's difficult at this moment in time to be in healthcare in general, EMS in particular. It's more dangerous now than it probably ever has been.
Chip Decker has served as CEO of RAA for the last 12 years.
For what the city of Richmond gets, we cost the average taxpayer very little.
The pre-scheduled calls help supplement the authority's $25 million budget, billing either the patient or Medicare and Medicaid. Only about a quarter of their budget is provided by the city of Richmond.
We're short on staff, so the calls aren't decreasing because of it. So the people we do have to run the calls that more people would have run. So they're having to work harder. And so their stress level is higher, and they need to be compensated more.
How are we fixing this? Because I've heard that it's only going to get worse.
What we are doing is working on ways to pay them more, and we are working to reduce the number of hours in the work week.
So, just a small highlight. Basically, it's the old adage. If call volume wasn't as high as it is now, staffing could be at a lower rate, and it wouldn't make much of a difference. The stress level would be lower, but that's not the reality of the 911 system. 80, if I remember right, there was 80 to 90% of all 911 calls are medical related or medical involved. And so when you run people into the dirt like AMR does with this operational model, people don't want to come to work. So you don't pay them, you overwork them. There's no morale, there's no lunch break, there's no relief at hospitals because of long ER wait times, and therefore there's no available units. So when people actually do come to work, they're just absolutely demoralized as soon as you go in service, and it's absolute crap. Now in Northern Virginia, was Northern Virginia. The primary county was Prince William, about 12 miles or so outside of DC. To the south, we are one county below Fairfax. And if you're in the industry, almost everybody knows Fairfax County. They like to be the golden child of the industry, for lack of a better phrase. And we were a combination department. So what that means is we had volunteers as well as full-time career staff, and the career staff would do 12-hour shifts, 4 or 5 days a week, 6 a.m. to 6 p.m., and then the volunteers would cover nights, weekends, holidays, special events, and things of that nature. And what I think a lot of people don't know is not only did we save them money, but we saved them stress. We saved on the headache. We used all the same equipment. We had the same training instructors, the same training objectives, the same uniforms. Literally, the only difference between us was um, if we got paid or not, or if they gave us other benefits like, health, dental, life, all the other normal stuff. We were not compensated financially, but we did it because we live in the community. We like the county we live in. We want to give back as much as we can, and that was our primary way of doing it. Um, so when it comes to my company, I plan on being a combination department. I want to bring back the volunteerism. I want to bring back the community pride. There was I remember distinctly years and years and years ago where everybody in the community would know where the fire station was and they knew who was on shift and they would stop by just to say hey, if you're out doing truck checks in the morning, if you get back from a call and you leave your big bay door open, they would come by and just say hey, introduce themselves, and just strike up a conversation. Nowadays, I've lived and worked all over the East Coast. It's the community engagement, community involvement, community pride has gone way down. Volunteerism is way, way down, and I think we need to make public safety great again. Um, but it's a multifaceted approach. So let's finish up the video and then we'll get out of here.
But because of a current employee shortage, the agency only staffs about half of the number of ambulances the city needs during the day.
There's a whole lot of ambulances out there that just sit because there's no one to staff them.
Decker says he needs more funding from the city or the federal government.
And slow, deep breaths, okay?
These former employees speak out, so residents pay attention in hopes of preventing something like this from happening again.
Try not to move. Try not to move. Should have never had to wait this long.
Agreed.
Chief Decker tells me they always respond to the most serious calls first and admits the system is strained and could use another 40 employees. Stay with us. Later at 11, you'll hear more from the employees at RAA and why they say the residents of Richmond abusing the 911 system is taking resources away from the streets.
All right, so the video's out. Basically, I need to do a whole video on 911 abuse because it's absolutely ridiculous. Every city, every county, every agency has their frequent flyers where they call because they stubbed their toe, they call just to say hey, they call because they're lonely, they call just for advice. I mean, that's not what 911 is designed for. It's not the reason it was created. Um, in creating, these types of nuisance calls really takes away from the true emergencies, your car accidents, your heart attacks, your trouble breathing. And just like you saw in this particular video, waiting an hour for an ambulance, very, very common with this particular operational model. So I've ragged on the system status management crap ass model quite a bit, and the solution is to do more of a fire based model, which is you have stations, you have substations, you have area offices all throughout a county or a city or insert jurisdiction here, and essentially staging equipment closer to calls reduces response time. Now you have to have the numbers for that, but that is the most common solution, but it's expensive. So the video is already kind of getting long. Let's switch the cameras around. All right, so if you would like to support me in my endeavor of creating a new company for Knoxville, thank you for watching this all the way through, or mostly anyway. If you want to donate to the channel, all proceeds go to creation of this company. Visit our website, send me a message. You can submit a video with a small donation. You can do a super chat, and I'll read those on the air as those come in. But thank you for sticking around, and I hope you have a great morning. If you found this video halfway educational, entertaining, whatever, like, share, comment, subscribe, and I'll see you on the next one. Have a great day, everybody.